Choosing the right database is crucial for nursing research and for finding high-quality, relevant information. Some of your best bet databases, or the ones recommended to start with, are CINAHL, Cochrane, and PubMed. This video will explain the differences between each database and when it is most appropriate to use them. CINAHL is the cumulative index to nursing and allied health literature. While the name sounds intimidating, it is actually a very user-friendly database that is not too hard to navigate. Most of the journal articles you're going to find here are scholarly, academic, and peer-reviewed journals. There's some popular content included, but overall, you're pretty safe that you will primarily find high-quality research for your paper, for your presentation, or any other project. Because CINAHL focuses specifically on nursing and allied health topics, it is often recommended as the first database you search. It already places that focus, that lens, on specific nurse-related topics for your research. When searching in CINAHL, you can use filters to narrow your results. For example, you can limit your search to peer-reviewed or scholarly journals. You can also apply publication filters to focus on specific date ranges, and use the source type filter to include materials such as dissertations or books. Cochrane is the Cochrane database of systematic reviews. Cochrane is a major contributor to the evidence-based practice movement. They really want us to look at the research, to look at studies, to find the good studies and figure out what those good studies are telling us. What does the evidence show for the efficacy of a treatment, of a medication, of a process or procedure? When searching in Cochrane, the interface will look and feel similar to CINAHL because both databases are provided by the same vendor, EBSCO. However, it is important to use broader search terms in Cochrane because Cochrane is not a database of individual journal articles. Instead, it provides systematic reviews, reports that researchers at Cochrane have created based on all the studies they can find on a topic. These are very in-depth, comprehensive, and lengthy reports that will tell you every study that the Cochrane researchers could find worldwide, going back in time based on this topic. These reviews evaluate which studies were good studies and which studies were problematic with limitations. It's kind of everything you need to know about the published studies all in one place. So if you find a report on your topic, it's a goldmine. If you do not find a relevant review fairly quickly, move on to another database. Do not spend too much time looking at Cochrane because you will not find a review for every topic. PubMed is a database used to find biomedical peer-reviewed journal articles and clinical studies. This is a free database maintained by the U.S. National Library of Medicine and is widely used in healthcare and scientific research. PubMed searches content from three major resources: Medline, PubMed Central, and Bookshelf. Medline is the largest component of PubMed. It contains citations and abstracts from journals that have been carefully selected for quality and relevance. Most peer-reviewed biomedical journal articles you find in PubMed come from Medline. PubMed Central, or PMC, is a full-text archive that includes articles from journals reviewed and selected by the National Library of Medicine, as well as individual articles collected for archiving and compliance with funder policies. Bookshelf is the final component of PubMed. It is a full-text archive of books, reports, databases, and other documents related to biomedical, health, and life sciences. PubMed is especially useful when your topic is more broadly related to healthcare, such as disease etiology, medical treatments, clinical research, or therapies. However, for topics related on nursing, like nursing practice, patient education, or allied health professions, CINAHL is a better database to use. When you search in PubMed, you can use filters similar to CINAHL and Cochrane to limit publication dates, text availability within PubMed, and article type. If you need help choosing a database or refining your research, remember, you can always contact us through our 24/7 chat service or reach out to your librarian for help. Happy researching!